Welcome to the Rational Egoist. I'm your host, Michael Liebowitz. Today's guest is somebody that I met on Facebook, of all places. And Ashley Stahl is a transgender woman. And I posted about Dylan Mulvaney and the whole Bud Light controversy in a rather vibrant debate sort of picked up on the post. And I was really impressed with how Ashley conducted herself. So I decided to have her on the show. Ashley, welcome.
Yeah, absolutely. Thanks for having me and giving me a chance to share my perspective.
Sure. So you would define yourself as a transgender woman. Would that be accurate?
Yeah, I think that's accurate. We can get into some of the definitions, and I think a lot of arguments around this issue come from when people, they like to quibble over the words that are used, and that's fine. But at the end of the day, I think there's a couple key concepts that come into play with that. But as a transgender woman, I believe I am transgender and also a woman. And so I think, there's a little bit of difference between gender and sexuality, and gender and sex. And I think that is where some of the debate comes in.
Okay. So what exactly does transgender mean?
Sure. So a transgender person is someone who was born into a particular sex and have throughout the course of their life, there's a variety of different stories and ways that people come to recognize this, but recognize that they're more comfortable presenting as and interacting with the world as a gender that doesn't necessarily align with the sex that they were born into.
Okay. So what about the idea, right? So for instance, I've never been a grizzly bear. So I couldn't even formulate in my head how to feel like a grizzly bear. So if I'm born male, as I was, how would I even know how to feel like a woman?
Sure. I guess a lot. So a lot of it is like for me, it was growing up, I recognized there was something different, but I never was like, you hear these stories of transgender children saying at age 4, 5, 6, I'm a girl. That wasn't my experience. There was an experience of feeling different, and over time, sort of learning what that was through introspection, and through really introspection and taking that time to look internally and both have the feelings, but then figure out where are those coming from and what do they mean? Because I think the combination of both feeling and rationality are important, and understanding those emotions don't come from nowhere, but they're important to understand. So I think there's elements of this that are societally driven. I think, I'm no expert, so I don't know. There's potentially differences in brain chemistry. There's potentially differences in any number of ways. I don't know where the origins of this are for me. I don't know if it's a mental illness. A lot of times there's a debate over whether this is mental illness or not. I don't know. What I do know is that I've had a feeling and desire throughout my life to interact socially in the way that women interact, to be friends with women as a woman or with men as a woman. And so, to present myself in a more feminine way. And so that's what's led me to sort of recognize that I'm transgender. I suspect for most people who are cisgender, which is, someone who's born in a particular sex and identifies similar to that, I would say you probably don't notice it, because there isn't a difference between socially how you feel like presenting and how you actually present. So
Okay, so would it be accurate to say, in response to that idea that, well, you've never been this, therefore you couldn't know what it feels like to be this, that growing up, and I don't know what age, and we'll get into that in a minute, but you had a general feeling of discomfort within your psyche, within your emotional makeup, your body, and the societal cues about what it means to be a woman. For instance, women like pink, women wear dresses, makeup, they, as little kids, they play with dolls, whatever. That appealed to you. So you wouldn't necessarily have to know exactly what it means to be a woman as much as knowing what society, for lack of a better word, I hate the word society, but ultimately the societal messages that are coming at you, those you were more comfortable with.
Exactly. And you know, ultimately those I was more comfortable with, but also like you have a very keen recognition from a very young age, or most of us do, I think, what is expected of you. And so there's that for much of my life, and I think, you know, many other transgender people, especially those who've transitioned a little bit later in life, that dichotomy of trying to figure out like, this is what's expected, this is what is pushed as the way that I should behave and the things I should connect with, and this is what sort of I'm actually feeling and what is actually going on with me.
So at what age did you start to feel different or uncomfortable? Not necessarily knowing why, but just having a sense.
Yeah, I mean, as long as I can remember, and I can point to specific examples, but I think in a vacuum, those are examples that potentially other, like that, you know, cisgender people experienced too, right? Like, so it's hard to say like, oh, that's an obvious sign that that's what was going on with me. But, you know, growing up, I can remember in kindergarten wanting to play with the girls and play house and be the mommy, or I can remember wanting to have my nails painted, or all of these different things. And I can also remember very, very early, very intentionally paying attention to the way that men and women behaved and mimicking and the way that men behaved, and absolutely avoiding anything that was remotely feminine or female, because that wasn't how I was supposed to behave. So, and that's as long as I can remember. I don't remember a time where I didn't have some level of discomfort around that.
Can I just tell you the term cisgender I find maddening? And the reason I just came across this word maybe a year or two ago, but the reason that I find it somewhat irritating is this. We have a vocabulary to describe what is referred to as cisgender, right? We have men and we have women. And I don't think that that detracts or minimizes your experience. So I just, to come up with a new term to describe something that we've always described another way, it just seems like that feeds the problem. I'll give you like an example of this. So I came up, I did some research and I found these words that are relatively new. Some are newer to modern vocabulary. You have transgender, transsexual, gender identity, gender queer. I don't know how to pronounce this, but it's ZIE in HIR. Then there's multigender, gender nonconforming, third gender, two-spirit people, cisgender, non-binary. And it also said in the research that many of these words have different definitions that vary from person to person, right? So
Sure.
Can you understand why people are frustrated with this onslaught of new terms, especially when, for instance, I wouldn't know what you want it to be called, right? So if I were to say, Ashley Stahl is here today, he's my guest, right? I know because you told me, but if you don't explain it to me, I may just not know. I'm not doing it to be a jerk. It's just
Sure.
the way that I speak. But in the environment today, it's like if you do that, if you make those mistakes, now you're a jerk, and that frustrates people. Can you understand that and why that happens?
Absolutely. Yeah, and I think that's a large part of my frustration with the dialogue coming from sort of the, whatever you want to call it, the LGBT activists, the left, the progressives, what, you know, whatever you want to call it, is I feel like this side has been overly aggressive in basically taking everything and turning it into a situation where it's like a victim mentality. And if anyone doesn't understand or doesn't, isn't woke, then they're a bad person. Like it's a moral problem. And I think there are situations where there are people being intentionally hostile or mean. And I think that but I think that a lot of that is like, we need to have, or in my perspective, like that we should have we should explain our perspective. We should be open to people not understanding, to disagreement. And so I do get it. Like, I think there's certain of those, like some of those words, I think there is some value in having. We do need a word to define the concept of what transgender is. Like this
Sure.
is something that exists in our society. and we need to have some language to be able to describe that. I think cisgender is one where in certain contexts it can be valuable. It can be a valuable word to have. I think in other contexts it's unnecessary. And so that's, for me, that's how I try and use it. But I don't think, someone making an honest mistake in how they, if I'm misgendered by accident, then I don't necessarily get super offended by that. It does make me feel a certain way because I am trying to present myself in a particular way. And when I'm not doing that effectively, then like it's frustrating to me. But I don't think that unless someone's doing that on purpose, then that's a different story. Then someone's trying to be intentionally divisive or hurtful, in which case I would probably try and not interact with them very much, just like you would if someone were doing that in any other way of life or whatever. But yeah, so I get the frustration, and I do think a lot of those words, and especially the idea that like they can just mean different things, and we're just supposed to accept that we're going to have language that just has arbitrary definitions and subjective definitions based on who is saying it, is not like, that's not effective. That's not a good way of communicating.
No, it's conceptual destruction,
right,
too.
Exactly. And so I think there's value in some of these words, and there is value in having this discussion. But yeah, I totally acknowledge that some of those words are pointless, and or in every case, saying that they can have multiple definitions is that's meaningless. Then they have no definition if they can have multiple definitions.
Exactly. Okay, so you're growing up and you're feeling differently, and you feel more comfortable around girls, being treated as a girl, if maybe acting like a girl. What are some of the psychological and emotional consequences of this? And I want to be clear, I don't mean in dealing with other people and their reaction to you. And I know it's difficult to differentiate, but I want you to try. So as you're coming to this struggle, what is going on inside you?
Sure. And so this can vary. I think I'm very lucky in that there are people for whom this disconnect ultimately leads to suicide or sort of very, very deep depression. I think for me, it was very much, at first it's a confusion. It's not understanding what's going on. And then it's like, I spent 15, 16 years of my life using substance all day, every day, in order to just ignore this dichotomy. This, I'm a man, but I have these feelings. What's going on? And so I spent, 15 and a half, 16 years, like I said, smoking weed or eating, in edibles or whatever, and large quantities, all constantly. And it, as you can imagine, that doesn't make you a happy person. That doesn't, contribute to your productivity in your life or improving your life. And so for me, it was very much doing everything I could to ignore the issue and push it back, so that I didn't have to deal with it.
So in objectivist terminology, because I noticed you said that you're kind of an objectivist, it would be evasion, right?
Exactly.
So,
100%.
So quite contrary to the idea that by being transgender, you're trying to evade the reality that you're a man, what you were actually doing was evading the feelings, the emotions, and the thoughts that you were actually having, and using substances, which is a time-tested tradition, what a lot of people do. I've done it myself, to just escape from what you're dealing with.
Exactly. And that was the most notable way, but it was other, it's spending a large portion of your time engaged in media, and not, which is great on your time off, but not being things that would make my life better. And yeah, it was evasion. It was really when I came to recognize, admit, and take action on this, sort of gender dysphoria that I was feeling, that I feel like I stopped evading reality, and where I started actually pursuing my self-interest in a much more effective and targeted way.
So how old were you when you decided to transition, and when did you actually begin the process?
Sure. So it's been a story of back and forth for me to some extent. So
Okay.
when I was 21 years old, I'm currently 34. When I was 21, I started seeing a therapist for this issue in particular, and came out to my parents, and based on their reaction and my, I really hadn't done the work that I needed to do in terms of frankly getting off of substance. That I was convinced that this isn't really what's going on. It's you're depressed, and therefore it's manifesting in this other way, and sort of shoved it to the back of my mind and went back into hiding for quite a while longer. And really, when I was 32, in the effort of, frankly, I was at a point where I was pursuing being a parent and wanted to do the things that I needed to do to be an effective parent. And I recognized that the substance use and this gender dysphoria were things that were just sitting out there that I was kind of ignoring and that needed to be dealt with if I wanted to be an effective parent. And that's really when I made the decision. And then when you begin transitioning, it's a little bit muddy. So like socially speaking, I would say October of 2021. Medically speaking, I started in December, so very shortly thereafter. And then it was October of last year, 2022, where I fully, there's no element of I'm out with everyone, I'm public. There's no element of hiding or that dichotomy any longer.
And have you gone through the hormone treatments and I think it's a hormone replacement therapy? Is that what it's called? I don't know the exact terminology.
Exactly.
Okay.
Yeah,
So
yeah.
you've gone through that.
In December of 2021, I started with hormone replacement therapy, basically blocking testosterone and adding estrogen and progesterone to achieve the physical sort of and emotional sort of effects that I was looking for to match sort of my identity internally with, or make my body match that as much as possible.
So taking these the hormone replacements, do you feel differently? And I don't mean physically. I mean, have you noticed a change in your emotions and in your thinking? Have they made you feel more feminine because you're increasing estrogen?
Yeah, I would say to some extent there is, and this is widely reported, that there is a emotional change when changing your hormones. Not surprising. It's hard for me to fully identify because I also quit using substance at that same time. So there's some changes that could be attributed either direction. But I think just from what we know about testosterone and estrogen, like there's a certain, like the predominant emotion that I experienced prior to transition was anger. When I was upset or whatever, it manifested in anger. Now it's, there is many more emotions, much more complicated sort of array of emotions. I get more emotional easier, that sort of thing. And some of that is due to the hormones. And I imagine that some of that is due to the fact that I'm no longer living in a state of sort of perpetual numbness to what I'm feeling. So
now, are there negative side effects to these treatments?
there can be. The side effects are minimal, and it depends on the specific regimen that you're on. The most notable is issues with, like, so people with bad heart disease are oftentimes cautioned in taking these treatments. It can create additional issues with blood clotting and those sorts of things, but it is far less than a lot of medications that are commonly being taken for a variety of different issues. And then depending on, so initially I was on a drug that very much, it's, for those who care, it's spironolactone, but it's meant to block testosterone. It is a diuretic, so that it causes some complications where you need to keep very well hydrated. There is a variety of potential side effects, absolutely, but they are minimal compared to many other drugs.
are the effects of these medications reversible? So in other words, if a year, 3 years, 4 years from now, you feel differently and you change your mind, I understand you're going to tell me there's no way that can happen,
Sure.
but for somebody it might, right? So
Sure.
are the effects reversible?
In some are and some are not. So for example, like I can speak a little bit to both directions, right? Because taking female hormones and taking male hormones are very different. In my case, taking female hormones, the breast development is not reversible. So if someone in my position were to change their mind and they wanted to remove their breast tissue, they would have to do so surgically.
Okay.
In terms of fertility, which is the most commonly brought up, I think, thing is it's a little less clear. For someone such as myself who went through a typical puberty, realistically, for several years, if I were to change my mind, I could probably go off the hormones and regain my fertility. There's no guarantee in that. It's possible that it would be gone forever. So that is something, I think, honestly, that's the biggest consideration. To me, that was the biggest thing that I wanted to make sure I was covered for, because I do want to have children. So I froze a specimen before transitioning so as to prevent that from being a major concern. The emotional changes are not permanent. The sort of little like the clearing of your skin, the reduction in body hair, those are not permanent, so that can all be reversed. And that's going the one direction. Going the other direction from born assigned, whatever you want to say, female to male, there is the biggest change that is not reversible is going to be the voice. So as you probably can tell, my voice has not really, I've made efforts to change my voice, but those have been through vocal training. My voice, when you go through testosterone, it permanently lengthens your vocal cords, and that doesn't change. So obviously going that direction, you will have a deeper voice. And if you wanted to go off, you will still have a deeper voice, and you'll have to go through the same vocal training that I'm currently working on and going through. So.
Thank you. So you consider yourself to be a woman. Now, a lot of people, myself included, although I wouldn't count myself necessarily with those people on their perspective, or at least some of them, I would say no. You're either a man or you're a female. What I would say is you are a man who identifies as a woman. If you want to be called the transgender woman, I understand that, that's fine. But the biological reality is, even if you have an operation, take hormones, whatever, you're still not a woman. That's my view. So if I'm wrong, how am I wrong?
To be honest, I won't quibble with you too much on that. Every cell of my body is XY. There's no changing that. There isn't a scenario where that's ever going to be different. There's not going to be a surgery or anything, at least in our lifetimes, that is going to change that. So, biologically speaking, you're right. Like my sex, in the case of sort of separating sex and gender, my sex will always be male. There is no changing that. I think that's not particularly relevant for most of the sort of discussion that comes up around this topic. I think if socially someone presents as, a gender that's different from their biology, like most of the interactions that you're going to have with a transgender person are going to be social, aside from a few, a romantic relationship or, things like that. There's not much where that physical biology is going to be as relevant. I think in most cases, it's actually the social identity that's going to be more relevant. But I don't quibble with you. Like there's maybe I might use different terminology or that, but generally speaking, you're not wrong.
See, the reason that it's important to me is because while I wouldn't necessarily call myself an objectivist, I consider myself a disciple of Ayn Rand. I especially think her epistemology is remarkable. It's phenomenal, right?
I agree.
And you have to identify things and you have to conceptualize things accurately. And for somebody to come and tell me no, this is a woman, that it's just not. And that's why it bothers me. It doesn't, I don't think any less of you. I don't deny what you're going through. I saw a program on PBS maybe 6, 7 years ago where they had little kids, and it was clear to me that these kids were going through something, that
Yeah,
it wasn't just a figment of their imagination, or the teachers weren't brainwashing them. It was real.
right,
So
exactly.
I don't have any quibble with any of that, and I don't think they should be discriminated against because of it. But I do think that it's important to properly identify things, and so we can have definitions. For instance, and like you said earlier, we have this new vocabulary where we have shifting definitions from person to person, and you can never gain knowledge about anything. Okay, so you now, since your transition, what is life like for you? I mean, not just, I want to know about, how are you feeling internally? How is the world receiving you? How are things?
Yeah, I mean, things are better for me than they've ever been. I'm engaging with the world so much more than I ever had before. I have so much more of a clear understanding of where I want to go and how to get there. So I guess to kind of put that into more concrete terms, before I was so focused on my career and pushing that ahead, and that's valuable to me. But what I've come to realize is, for me, like, building a family is ultimately like my true drive in life and what is truly important to me. And so I've made real efforts in order to do that. I've made a lot more friendships. I've gotten much more involved. Before, I wanted to hide. I didn't want to go out. I didn't want people to see me. I wanted to be as unnoticeable as possible. And now I have no problem. I'm not, still not the type of person who's like, oh, everyone look at me. But I have no problem being myself and building these relationships in my community, being more active. I'm much more comfortable with myself, with the way that I interact with people, and just a lot of the guards are down. So yeah, I mean, I'm much happier and much more capable of pursuing the things that I want to pursue and making my life happier and a better life.
Now, on social media, people can be vicious.
Yeah.
Um, I've had people say things to me on social media that are just absurd. And I know there's a difference when you're on a keyboard and when you're in person. Have you faced anything like that in your day-to-day life with people?
So I feel like I'm in a pretty good position. It's interesting. So for those who follow politics, I live in Lauren Boebert's district. Lauren is pretty vocally anti-trans. And but I live in a spot, her district ranges sort of from what is frankly potentially one of the most liberal portions of the state to one of the most conservative portions of the state, Colorado, for those who don't know. And so I'm able to choose which direction I'm able to go towards places that are more friendly. And when I do that, I don't, generally speaking, people engage with me as I want to be engaged with. They treat me with respect. They use the pronouns that I think I make a real effort to come across as. So it's rare that I have to correct anyone or explain, like, actually I would rather you use other pronouns. When I go to the more conservative portion of her district and I head out west, there is a little bit more of a challenge. Generally speaking, though, I think exactly what you said. Like, online, people are willing to very vocally put out their perspective. And I think in face-to-face interactions, I think plenty of people have opinions and maybe don't want to say nice things, so they just don't say anything at all. And so sure, there's situations where people have said sir instead of ma'am, when it's probably pretty apparent that I would prefer them to use, a set of pronouns or descriptors or whatever. Um, but most of the stuff, like, so I am part of an organization, PFLAG. It works with LGBTQ plus individuals and their families. And when I'm out doing stuff with that group in the more conservative, religious part of the state, I don't get a ton of hate face to face, but like if I post on a community board, about a meeting, people will go and secretly pull that down. So there's some stuff, but honestly, by and large, I think it's been a fairly positive experience face to face, and the internet is one of the sort of last places where people can just be horrible with no repercussions and
Yes.
get away with it.
So what does the phrase transgender rights mean to you?
Um, I I to be honest, I don't like having rights for different groups. Like I think that
Me
rights are
neither.
rights
I
and they
agree.
should, pertain to everyone. And so I think largely a lot of from a political perspective, a lot of the things that I would like sort of changed in regards to the transgender perspective politically is just getting the government out and allowing people to make their own decisions in their lives and the decisions for their children or for their family. And the government should only really be getting involved in like sort of the most extreme of cases where there's, actual harm potentially being done. I don't think that I have should have any special rights above and beyond anyone else.
I agree. I think if the government got out of the way in a lot of areas, things would be so much better. I
Yeah,
mean, just take the issue of school. If you had all private schooling, then it's up to the school to decide what their bathroom policy is, and then it's up to parents whether they want to send their kids to those schools or not. And it's the same thing with restaurants, stores, whatever. If the
mhm,
government's out of it, it's up to the store. It's a private interaction, and I'm free. If I don't like their policy, I don't have to shop there. And the same goes for you and everybody else.
exactly.
So, am I right that there's been and I know that it might be uh, partly deceptive because there's a lot of factors going on, but it seems that there's been a proliferation of trans people. Is that, do you think that's an accurate perception, or am I just being, I mean, look, people may feel more comfortable coming out nowadays. The media is focused on it more. People are more angry. There's a lot of factors that may be giving rise to this perception, but is there anything real to it that there's more people out there today that are transgender than there was maybe 20, 30, 50 years ago?
Yeah, I mean, statistically speaking, there are more people who are out publicly as transgender. I think probably when all is said and done, in terms of people who are actually transgender, it's probably roughly the same number of people as it has always been. But for myself, I probably would have just led a life of like less happiness if I lived in a world where I couldn't come out. I don't think there was if the society hadn't developed to the point where it was safe and comfortable for me to do so, I probably would have just continued living my life the way it was and been less happy. And I think there's a lot of people that's the case for. I also think, and sort of the people in the LGBTQ community aren't thrilled with this perspective, but I do think that there are, in particular, in regards to youth, that there are some, youth who are having different problems in their life and hear about this issue and think that this is the solution to their problems, and it isn't. And so I do think that because it is so politicized and out there, there's also more people who are incorrectly identifying as transgender that maybe isn't fully what's going on with them.
So you think there is
So
some social contagion perhaps going on when it comes to young people? That's
yeah,
where
I
I was
think there
going with
is.
the question. You
Yeah,
anticipated me and ruined
yeah,
my big my big question.
yeah. I do think there is some of that. Um, I don't think that that's necessarily like, well, actually, I'm fairly confident that's not the majority of what's going on, but I think it would be um, unobservant and unrealistic to say that that's not going on in some cases. I'm not going to sit here and say that there aren't people who detransition. There are. They tend to be younger people. They tend, there is definitely some of this social contagion thing, and that's to be expected when people are struggling in their lives and they don't know what's going on. They're going to look out and see what might be going on. And if they see this one thing very heavily discussed, like they might latch on to that and say, like, this is what must be what's going on with me, even when it's not. So I do think that that is part of what's going on here. Sure.
Okay, before we go, did I miss anything? Is there anything that you would like people to know about this issue that I didn't get to, or that you didn't have time to talk about?
Not specifically. I guess I'll finish out, I guess, with saying that the phrase that drives me the most nuts that the people in the LGBTQ community push, and I know why they push it, it has some value in some context, but trans women are women. It goes back to the issue of defining concepts that you talked about, and how that phrase, when used in certain contexts, really does destroy concepts. And what I want to put out there is that every transgender person that I have met, it's not an issue of delusion. You may have whatever disagreements you have with this ideology or with these people or whatever you want, but we know how we were born. We know what's gone on in our lives. I'm not delusional about any of that. I recognize that there is a difference between me and people who are genetic women, cisgender women, whatever term you want to use. But I think at the end of the day, that when interacting with me or any other transgender person, what matters is how we present socially and how we want to interact with the world, and how and all of that. So regardless of what you think is causing this, or what you think the issue is, or how you think it should be handled, I just encourage you to try and treat people with respect and dignity, and that's basically it.
Is there any place that people can find you, Ashley? I mean, I know you're on Facebook. Do you have a website or that organization? Anything you want to plug?
I don't specifically. What I will plug, I guess, is for those of you who are in the LGBTQ plus community, or if you are a family member of someone who is, and you're trying to wrap your mind around this and come to an understanding for yourself, look for a local chapter of PFLAG. That is an organization that I'm a part of, that I care very much about. And we do all kinds of support groups that we will, it's a great organization to try and find support and help if you're struggling through this issue.
Ashley, thank you very much for taking the time to join me today. I really appreciate it. I'm sure the audience will as well. For now, this is the Rational Egoist signing out. Remember, like, comment, share, subscribe. Till next time.